If you're applying to medical programs or looking to advance your research career, you already know the pressure. You're told you need the biggest, most widely recognized university name on your resume to secure your future. But judging a medical program by a university's overall ranking creates a significant blind spot. When you look at broad, multidisciplinary lists, hundreds of institutions devoted entirely to human health get pushed down the page or completely ignored. Take the familiar examples. You look at a place like Johns Hopkins, a comprehensive, multi-faculty university that happens to house an incredible medical school. To actually see the specialized medical landscape, we have to filter the noise. The AD Scientific Index for 2026 takes a different approach by mapping higher education institutions dedicated solely to health and medicine. This document details their strict criteria. The index actively excludes general universities. It takes heavyweights like Harvard, Johns Hopkins, and Oxford and deliberately removes them from the main list. If you only check the standard overall rankings, you miss the specialized powerhouses entirely. You have to decide if you want a generalized brand name or if you want an environment where every single resource is poured into medicine. Let's define what we mean by a dedicated medical institution. This is a university where 100% of the funding, the infrastructure, and the faculty exist for a single purpose: advancing human health. These dedicated schools operate entirely in their own space. While a general university has to divide its attention and budget across arts, engineering, and business, a dedicated medical program focuses exclusively on health sciences. The University of California, San Francisco is a perfect example. It is a health sciences-only campus, built entirely around medical research and patient care. Or look at the Karolinska Institutet in Sweden. It functions as a single-faculty medical university. The reality on these campuses is highly concentrated. Every peer you meet in the dining hall, every laboratory on site, and every dollar of available funding is directed toward healthcare. But there is a clear trade-off. You lose the chance for cross-disciplinary collaboration. You cannot walk across the quad to consult with a top law professor or borrow equipment from an engineering department. The focus is absolute. To see how effective this concentrated model is, we need to look at the top tier of the 2026 index. This table ranks the best dedicated institutions based on their overall world position. UCSF takes the number 1 spot, followed by Karolinska at number 2. Moving down the list, Charité Universitätsmedizin Berlin secures the number 5 position globally. These institutions reach the top of the index because their faculty density is entirely made up of medical scientists. Their institutional scores aren't diluted by less active departments in other disciplines. If your strict objective is clinical excellence, these dedicated schools offer an unmatched concentration of resources. You just have to be willing to give up broad academic exploration to get it. It is easy to assume the best academic path lies entirely in North America or Western Europe, but the geographic data shows a different reality. This table breaks down the institutions by continent. Asia dominates with 767 dedicated medical institutions, compared to North America's 80. Looking at country distribution, India alone accounts for 341, nearly a third of the global segment. Iran also shows a heavy concentration with 65. The infrastructure required to support this volume is massive, driven by national investments in places like the All India Institute of Medical Sciences. For an international student or researcher, this creates a strategic choice. Expanding your search to Asia opens doors to rapidly growing research hubs and intense clinical volume. To tap into that Eastern research momentum, you have to navigate different regional academic systems. You are weighing raw scientific output and clinical exposure against traditional Western brand recognition. But when we talk about momentum, you have to read the data carefully. How do you know if a university is truly improving its research output, or if the underlying numbers just shifted? This page tracks rising institutions. In the top 1,000 band, a jump of 39 spots, like Avaz Jundishapur, represents genuine institutional growth. Contrast that with the bottom of the list. In the 2,500-plus tier, institutions like Bharati Vijayapith jump nearly 9,000 spots. A 4-digit jump like that is almost always the result of a deep-tailed data recalculation. It is a statistical adjustment, not an overnight improvement in academic quality. Making a career decision based on deep-tier volatility is a high-risk bet. True institutional momentum is measured by fighting for a few dozen spots near the top, not by mathematical leaps at the very bottom. Dedicated medical institutions are incredibly effective at what they do, but they are a highly specific tool built for a specific type of professional. The right choice depends on your primary career goal. We can break this into two distinct paths: clinical specialization or interdisciplinary innovation. If your goal is clinical excellence and highly specialized medical research, you want to target the top dedicated institutions from the AD Index. The trade-off here is certainty. You must be completely committed to a medical path, because pivoting into outside disciplines is structurally difficult when those departments simply don't exist on your campus. On the other hand, if you want to combine medicine with biotech entrepreneurship, public policy, or artificial intelligence, you belong at a strong general university. The catch is that at a comprehensive university, your medical department has to constantly compete for funding and institutional attention against massive, equally prestigious programs. Rankings are a comparative compass, not a final verdict. Your ultimate choice requires matching the specific architecture of the university to the exact trajectory of your career.